Not very long time ago, I was here in full capacity as a student studying my master's in global health, taking classes, with Larry, with, Chris Woods and Carrie Stewart. So I'm really, really appreciative to get this opportunity to give a talk here. To give a brief introduction again, as Dr. Woods mentioned, I am a virologist by training, and I have a PhD in molecular biology, but this was coming here and doing my master's in global health was a life-changing experience for me. So just saying that. So to start with, as I mentioned, I'm a virologist by training, and why that is important and why I decided to study virology was because one of the earliest experiences that I had as a kid. So as a toddler, I got chickenpox, and I couldn't understand why I wasn't allowed to scratch my pustules or play with my friends, or even how I got it. Like, I couldn't understand. Over the years, I grew up in India, and I saw plague come to Western India, and I saw really scary pictures on the newspaper of giant rats and how plague is a major issue. Then there was SARS in Asia, and I remember growing up in India reading headlines how airline pilots from India, where there was no case of SARS, refused to go to and fly to countries in Asia that had SARS. So that really had a lot of impact on me, and that was how my fascination with viruses began. How could something so tiny not only damage health, but also elicit so much of fear? So, growing up, a lot of my friends had dolls. I had, and still do, giant stuffed microbes. So, that's how my fascination began. But today I will be talking to you about something that's very close to my heart, and it is part of the project, the thesis project that I did here at DGHI as part of my master's program with Dr. Pade, Dr. Stewart, and Dr. Woods. So this was a project in Nigeria, and it looked at the impact of fear-based aversion behavior during epidemics with a focus on Ebola. So we're talking about diseases. Let's talk about the latest kid on the block, Zika virus. I'm sure some of you, it's just summer vacation just ended. A lot of you, I'm sure, just came back from fieldwork. And especially if you've worked in Central or South America, did any of you work there at all in this group? Okay. I'm sure people who did, or while you were considering that option, you must have given a thought to Zika virus. I, in fact, know people who actually changed their vacation plans to Puerto Rico because they were afraid of getting infected by Zika virus. At one of the talks that I gave at Switchpoint, a lady came up to me whose niece is a Paralympic athlete, and she told me how that was a major concern they were facing. So World Bank conducted a study, and they found that the cost of Zika in the affected regions of Americas in 2016 alone is going to be $3.5 billion. Now that's expensive. Epidemics are expensive, really expensive. But why are they so expensive? Yes, they affect mortality, morbidity, they affect productivity, all of that. But is there something we're really missing out here? I think so. I think one of the most important reasons why epidemics are so expensive is one word, and that is fear. Now, this is one of my favorite movies. If you haven't seen it, I highly encourage you to watch it. But more than the movie Contagion, I love its tagline, "Nothing spreads like fear." And that is especially true when we talk about epidemics. So, the cost of fear is extremely high, as we talked about. Yes, Zika, $3.5 billion. SARS cost the global economy $40 billion in 12 weeks. Ebola cost the countries of Sierra Leone, Liberia, and Guinea $2.8 billion. But more than 80 to 90% of that cost was due to fear and not due to the disease. And that, for me, is incredible. So focusing on Ebola, more than 28,000 infected, more than 11,000 deaths, 10 countries. One of those countries was Nigeria. Now, I remember in 2014 being in UNC, where actually Dr. Woods was one of the keynote speakers, And the discussion was going around Nigeria, and the mood in the room was that it is literally game over if Ebola reached Lagos, the capital of Nigeria, not the capital, one of the big cities, financial capital of Nigeria, a city of 21 million people. Unfortunately for us, it did reach Nigeria, it did reach Lagos. But fortunately for us, it was contained within 93 days. It was a huge success story. Despite the success of containing the disease in 93 days, the cost of Ebola in Nigeria was estimated to be $186 million. That's less than 0.03% of its GDP. But is that all that was to the cost of Ebola? Was there something more that was going on there? Was there something that we were missing out? I think so. So I decided to look at the impact of Ebola on the private sector, focusing on Nigerian businesses across different economic sectors. And I decided to ask two things. Not only what was the impact of the Ebola on the private sector, but also what role can the private sector play in Ebola response, or effectively in building epidemic resilience. So I did this study in Nigeria during 2015. I spoke to 78 people, so 78 people were interviewed. There were in total 62 in-depth interviews, because some of them were group interviews. These people ranged across, represented 50 stakeholders across 11 economic sectors. To confirm my findings from survey, I also conducted a public consumer survey at 3 different sites in Lagos. What did I find? I found that the impact of Ebola on Nigeria was higher than $186 million. There were hidden costs that were not accounted in the estimates. There were costs on the businesses, there were costs on the economy that were intangible in nature and can often be very difficult to incorporate in those kind of estimates. I also found that certain sectors were disproportionately affected, and even sectors, for example, pharmaceutical sector, that would be doing really well, you would say, in an epidemic scenario. People would probably be buying more drugs, but that wasn't the case. Almost every sector, every economic sector that I spoke to, spoke of losses, and I'll be coming to that in a bit as well. So what is Fearonomic effects? So I define Fearonomic effects, a word that I coined to describe the direct and indirect cost of misinformation and fear-based aversion behavior that is exhibited by individuals as well as organizations and even countries during an epidemic. And during a high stressor instance like an epidemic, there can be multiple downstream ripple effects due to fear-based aversion behavior. So what causes the Fearonomic effects? What are the different factors that feed into it? Especially, for example, if a disease is a new disease, or it's in a new geographical region, there is sort of lack of data, this lack of information, and that can enhance and exacerbate the Fearonomic effects or fear-based aversion behavior, as well as misinformation, because people don't know what the disease is about. Misinformation, as I mentioned, myths that are clearly not right, but they actually dictate how people behave. Knowledge gap, access to resources, understanding of the disease is a major factor in Fearonomic effects. Perception of disease via media. In fact, that's a major issue with Ebola, especially we saw that in the United States, when Ebola came to US, media absolutely went crazy. There were headlines, it was distorted. The perception of Ebola and the effect of Ebola in the United States was extremely distorted. And this was true across the world. Case fatality rate. How lethal is the disease? That also affects Fearonomic effects. You're likely to have more aversion behavior if you're afraid of the disease more. But how does the Fearonomic effect works? How does it really cause the impact on economy? So first of all, it affects behavior, socioeconomic behavior. It affects our consumption patterns. So during the Ebola crisis in Nigeria, there was an increase in consumption of sanitizers by 400%. That's insane. But what's even more insane? Is that a lot of companies that were manufacturing these sanitizers weren't able to make profits because of the demand shocks. and the problems with logistics. There was suddenly, they did not expect or predict it to be such a high number of consumption. Other things, sales of antibiotics went up because people were afraid to go to the hospitals. And that affects the economy as well. There was a lot of stigma. There was 79% of people were afraid to hug. It affected trust issues among people. 75% of people kept away from crowded places, and that affects the economy. Even sales of meat products and suya, or even bakery products, went down. And that was, for me, very interesting and shocking to see. So, huge impact on behavior. Financially. Now, financially, Fearonomic effects can also have a huge impact. For example, individually, 16% of people I spoke to reported job loss directly due to Ebola in the survey. 29% of people said food prices went up. 28% people said they had lots of work opportunities because of Ebola. So, huge impact on individually. Bank lending was affected. Bank lending to individuals changed. They started becoming more careful in their practices to lending individuals, which affects entrepreneurship. They became more wary of lending to hospitals and schools because they were more likely to get affected by Ebola, especially hospitals. Aviation sector was affected. 78% of flight occupancy, flight occupancy went down by 70%. That impacted their revenues by 40%. Oil and gas sector, one of the biggest sectors in Nigeria. Now, one would think, how would they be affected? Vessels were turned away by other countries coming from Nigeria for fear of Ebola. And just to explain the potential impact, if an oil rig was quarantined, the cost of a non-operational oil rig ranges between $10 to $32 million. That's a lot of money. So huge impact financially there. Health-wise, there was a lot of impact on health. So utilization of health services went down, even in hospitals that were not affected by Ebola, that had not seen a single case of Ebola. The patient volume went down by 35 to 50%, even in those hospitals. So people were afraid to go to hospitals because they were afraid of getting Ebola. Not only that, hospitals started turning away patients who were with fever because they were afraid of patients. And that also impacted, both of these factors impacted the revenue of hospitals as well. Countries like Nigeria, and India is also a similar country, a lot of health system is private sector. Private sector is a major player in healthcare. So you can just imagine the impact on health sector. And if you're turning away febrile patients and you're afraid to go and you're self-medicating, just think about how it would impact the other health outcomes. So huge impact there. Collateral damage. People were afraid to help someone. If someone collapsed, they were afraid to help them out. There were cases where people died at airports of heart attacks because no one would come and help them because they were afraid the person collapsing right there had Ebola. So huge effect there. Business continuity. 34 countries at that time levied trade and travel restrictions on the Ebola-affected region against WHO's recommendations. And that had a huge impact on business because projects were delayed, projects were moved. There was a ship supply company that, due to delayed projects, lost $6.3 million. And that's just a start. There were so many companies that I spoke to where they had moved the training programs or even whole projects. So it affected the business continuity as well. So huge impact on economy that we often miss out when we make these estimates. So when you talk about Ebola, it was really unique in the fact that not only it was a health crisis that reached a new geographical region, West Africa. It was the first time Ebola came to West Africa, the first time it came to cities. But there was another interesting aspect. Initially, there was lack of data. There's lack of data that actually led to exacerbation of the epidemic. And midway down the line, there was bad data, misinformation. And why is that important? Because misinformation, as we saw, drives the Fearonomic effects. It drives fear. And just to give an example, I asked people, how did they think? So I did this survey in Lagos across 3 different sites, and I asked them, how do you think Ebola spreads? 68% of people said it spreads through touch. Wrong. Ebola does not spread through touch. 28% people said it spreads through pork. Wrong again. It does not spread through pork. 23% said it spreads through air. No, it does not spread through air. So when I asked these people, how did you source your information? 71% of people said social media. Now, I love social media, and I'm sure so do all of you. It's a great tool to rapidly disseminate information, but it is also a tool that can rapidly disseminate misinformation, and which is why we have to be super careful here. To give example how misinformation can lead to epidemics. So in Nigeria, Ebola came with a Liberian diplomat who broke his quarantine. His sister had just died of Ebola. He had attended the funeral and he was under quarantine. He broke the quarantine and flew to Lagos. Why? One of the reasons was in order to get access to holy water. One of the Nigerian pastors was marketing this holy water that could cure AIDS, that could cure Ebola, and he wanted to get access to that. That single chain of transmission led to 20 cases and 8 deaths in Nigeria. Another example, salt. During the Ebola crisis, there was a lot of rumor going around through phones that if you drink salty water, if you bathe in salty water, you can be protected from Ebola. And what is really sad, in Nigeria, 20 people, remember 20 people got affected by Ebola? 20 people were hospitalized in Nigeria because they drank so much of salty water that they had to be hospitalized. 2 people died because of this. And not only that, this actually leads to risk behavior, because misinformation can lead you to have risky behavior that can actually be counterproductive in an epidemic setting. But one of the biggest examples that I like to give when I talk about impact of Ebola is the Index Hospital, where the Liberian diplomat was taken. Now, this hospital was one of the finest hospitals and played a major role in diagnosing Ebola and effectively containing Ebola. It's one of the reasons why Nigeria was a success story. But in the words of the director of the hospital, they put themselves online. It was as if they jumped on a grenade. Why did they say that? Because soon after, even after they were declared, once people found out that they had an Ebola patient, rumors started flying around. It was labeled as the Ebola hospital. And even after they were declared Ebola-free, 90% of patients refused to come back. I spoke to them a year later almost, and even after a year, only 20% of patients had come back. And this was one of the main reasons why other private sector hospitals, they saw how this really good hospital was affected, so they started turning away patients with fever. Healthcare workers were really affected. In terms of healthcare workers, when you talk about, a lot of healthcare workers told me about how they were stigmatized against just because they were healthcare workers or doctors. Even people who worked in the quarantine center talked about how their biggest challenge was fear. In fact, one of the stories that I like to highlight, just so you can get, there was a doctor that was working in the Index Hospital, who, by the way, was not affected by Ebola, did not see the Ebola patient. Her children went to a school, and basically the parents of the school said, you have to stop this child from coming, otherwise we won't send our children to school. That is the impact of Ebola. So as you can see, the virus is not the only enemy. So is fear, so is misinformation, bad data, lack of data, big problems. But how can countries then limit the impact of Fearonomic effects? Well, first of all, swift response from government is really helpful. Now, one of the most interesting aspects of the Ebola epidemic in West Africa was that most of the flights stopped flying to Sierra Leone, Liberia, and Guinea, except 2 flights, Brussels Airlines and Moroccan Airlines. But in Nigeria, all the flights continued to fly, and there were 2 main reasons. Number one, it was too big of a market to lose. But more importantly, they saw the government having, they started seeing, entry screening, exit screening. They had confidence in the measures the government was taking, and that really helped them to feel confident that despite a reduction of, flight occupancy of 70%, they were willing to fly and continue flights. Visible measures help. 93% of people I surveyed said that if a place had visible measures, like they were using sanitizers, they were changing gloves, even if it was a hospital, they would feel confident going there. And that's one way you can limit the Fearonomic effect during an epidemic. Taking measures to collect data in crisis and having past experience. One of the major reasons Nigeria was a success story was it had polio emergency operation centers in place. It had trained epidemiologists as a result who could collect data, who were adept at contact tracing. And this experience really helped them out when they had to deal with Ebola. They in fact set up Ebola emergency operation centers based on the polio emergency operation centers. Partnering with community leaders, and again, Nigeria did that. They partnered with religious leaders, traditional rulers, to ensure that myths are dispelled, and that's one way you can actually fight against bad data. You involve influencers. Disseminate good data, accurate information. And one of the people that I worked with in Nigeria was this Twitter-based platform called Ebola Alert. Now what the platform was doing was, it was making sure right information on how you can protect yourself from Ebola was reaching out to people. In fact, even CDC was following Ebola Alert. They were making sure information on outbreaks was going out very swiftly. And they played a very instrumental role in actually dispelling one of the rumored Ebola outbreaks in Nigeria. It was a food poisoning issue, but they played a key role. So dissemination of right information. And of course, partnering with the private sector. People in a lot of countries, including my country in India, they have issues with trusting with the government. You're always thinking, oh, is this a conspiracy? Is this like a way to get votes? So private sector is really good at building community trust. So that's one way you can really help. What other ways can the private sector help? So private sector can help in all three phases: preparedness, response, and recovery with respect to an outbreak. So first of all, just by protecting their core business operations and having systems and architecture in place, pandemic preparedness recovery plans, or having, what to do contingency plans. Just by that, they can really help out in a scenario of an epidemic. Private sector often has expertise and skills, so they are adept at logistics. They're really good at forecasting. So if as government shares data with private sector on that, they can actually help forecast what kind of diseases are more likely to happen. They can, so there's logistics, supply chains. Those are another areas where private sector can help. In Nigeria, private sector actually took the onus of getting not only basically suits or personal protective equipment, but they also played a very major role in making sure they can get antibiotics for the government or medicines that they would need in time of this crisis, furniture. So, they have expertise in logistics. They can really help in procurement. So that's one place they can really help. Material assets. Private sector can help. They can either donate money in cash, or they can donate in kind, with furniture and, personal protective equipment. So again, that kind of company that prefers in cash and in kind differ, but both of them are material assets that can really help in a response. But more importantly, advocacy and political lobbying. As I mentioned, 34 countries restricted trade and travel, which affected private sector also really badly. But private sector has a lot of clout, and that form of political lobbying and advocacy can really help in crisis moments during an epidemic. I'd like to end with this Primo Levi quote that actually someone I interviewed during my research used. And I think it's very apt. It was used for Holocaust. It happened, therefore it can happen again. It can happen, and it can happen anywhere. And this is very true of epidemics. So in the end, the one vision that I'd really like you guys to take from this talk is that we can limit the cost of epidemics. We can limit the impact of epidemics. And that is by enhanced partnerships, not only multi-sectoral and public-private partnerships, that is by synchronizing, by working together and collaborating. So hopefully that will help us in future in mounting an effective response and strengthen epidemic resilience. Thank you.